Hi, I'm Gary White for Central Kentucky Television. I'm here with Bobby Harned, who is the director of the Flaget Cancer Center at Flaget Memorial Hospital, a part of Kentucky One Health here in Bardstown. And there's lots of promotion about October is Breast Cancer Awareness Month, and you're wearing your pink,
yes.
right? Have you been wearing pink all month?
Just about, yes. I told a friend of mine I need to go get some more pink.
Yeah, exactly. But we want to talk a little about breast cancer awareness, but we also want to hit upon some of the things women need to know and those in their family need to know. And also we're going to end up talking a little bit about November is Lung Cancer Awareness Month and about some new procedures or methodologies that are available with Flaget Memorial Hospital. So let's start off talking about breast cancer awareness. What do people need to know about breast cancer?
Well, unfortunately, breast cancer is very common in women. It's one of the most common cancers in women. And the most important thing is breast self-awareness. And a lot of people say, what does that mean? It's just important that you perform monthly self-breast exams. You can either put it on your calendar or put a little note by your makeup or your mirror before you hop in the shower. That's typically the best time to do it. And just feel your breasts and see if you notice anything different. If you notice any lumps or bumps, if you notice any changes or drainage in your nipple, that's something that you really need to notify your physician. And then schedule an appointment, and he would be able to, or she would be able to do a clinical exam, and then if a mammogram was indicated. And really those self-breast exams should start around the age of 20 and earlier if you have a history of breast cancer in your family. And women after the age of 20 should have an appointment yearly with their physician for them to perform a clinical breast exam on them. So it's really about noticing change in your body, and that's, really just about anything. But with breast health, it is very important. Age is a big factor with breast cancer. We can't really change our age, but there are some things that we can do to stay healthier. And to hopefully maybe decrease our risk of breast cancer. And it's similar things for everything, but like not smoking, that's huge. Exercise is big. Eating healthy. If you are of the childbearing age and you do decide to have children, if you do breastfeed, it does decrease your risk of breast cancer. So that's something important to think about.
Now, you were talking a little about doing the self-exam and mammograms. When should mammograms get started on a regular basis? There's
been a little controversy about that, but really the data has shown after the age of 40, mammograms should start, and they usually say annually, so do that annually with your physician. It does require a physician order for that, and the reason why is if there's something abnormal on your mammogram, we want to have a physician to make sure we get those results back to so that you follow up on any of that. So that is one of the first steps for your mammography after the age of 40. Of course, if you notice any changes and it's been less than a year, I would still call your physician.
And as we said, early detection is a very, very critical factor, because you're saying if it's detected early, you have a good chance of longevity.
Yes.
But as it progresses, those numbers kind of go down.
And that's really true with any cancer, but due to a lot of research and the Susan G. Komen Foundations, they have really done a lot to help with breast cancer awareness. It's about educating women, empowering women to take care of themselves, to take control of their health. It's just so important. But if a woman detects her breast cancer in the early stage, that would be stage 0 or stage 1, that's where the tumor or the cancer has not gone outside of the breast tissue or into any lymph nodes. There's none of that involvement. Then your chance of surviving 5 years is 100%. So
that's great.
Early detection, I can't say it enough. It's key, and it begins with yourself and taking care of yourself and doing those self-breast exams.
I want to mention too that Flaget Memorial Hospital has the ability to be there for diagnosis and then through treatment all the way through survivorship, correct? We
are just so fortunate. In the small community, Flaget is a small community hospital, but it really does offer a lot of services where we can take care of the residents in our community and surrounding communities right here close to home. You don't have to fight the traffic or the parking garage. Flaget, we have several diagnostic modalities to diagnose breast cancer. One is digital mammography, and it gives a more detailed picture than the old mammography. We can also do stereotactic biopsy, so if they do have a nodule and it's deep in that breast tissue and it's difficult to get to, they can use an ultrasound and guide the needle in specifically to that cancer that they see. And then they're able to take a biopsy from there. We also do breast ultrasounds, which tells you a little bit more in a little bit more detail than mammography. And then lastly, we are able to do PET scanning if we do diagnose the cancer, and that's to detect if there has been any cancer throughout any of the body. And then we have several physicians at the hospital that are able to take care of our patients. We have Dr. Shannon Goley, who is a general surgeon, and she specializes in breast reconstructive surgery and breast surgery. And she's new to Flaget, and we're so lucky to have her here. So if you were to need a lumpectomy or anything like that, we can do it right here close to home. And then, of course, at the Cancer Center, we're able to treat any type of cancer, whether it be through chemotherapy or with radiation. Dr. Monty Martin is our medical oncologist, so he's our cancer doctor. He's also a hematologist, so he can take care of anybody that has any blood disorders, or maybe they need help with thinning their blood or blood clots, that sort of thing. And then Dr. Joseph Lanzillo is our radiation oncologist. So we have this awesome radiation suite where we can actually do radiation to our patients. And, you know, to hear the fact that we can offer this right here, you pull right up to the front door of the Cancer Center and walk right in. So it's really nice.
That's great. Because, you know, cancer is a horrible thing when you're diagnosed, but the treatment can be very impactful and difficult, and it's nice to have it locally so you don't have to travel farther and deal with that as well.
My physicians, they like to refer to our Cancer Center as a boutique because it's small. You know, everyone that works there is from the community, and usually we know you or know your family, and after you come in the second time, we're able to call you by your first name. They did a really good job when they designed the Cancer Center. They made it really zen and calm feeling because it is an anxious time. Right. We have a nice fountain in the waiting room, and it's just real peaceful. And if anybody wants to take a tour of the Cancer Center, they can come by at any time. And actually on our patients when they first come in, we try to do that with the patients and their family. We'll actually take them into the radiation vault and show them where the radiation's given, just because it sounds so spooky, and it's really not. There's music in there, it's really nicely decorated. They have mood lighting up on the ceiling because you are usually laying flat. So that does help the patient and the family just to say it's not so spooky looking.
Exactly.
Yes.
We also want to mention that recently Flaget and Kentucky One opened some satellites over in New Haven, Williamsburg, different areas. And for October, you're doing some special programs there as well, right?
Yes. Actually, Kentucky One Health challenged all of their facilities to do a survey to see what we thought our community needs were. So it was a community needs assessment along the healthcare area. And there were 3 needs identified. One, the top was cancer. Then we needed education, better diagnosis, and treatment of cancer. And we're lucky to have the Cancer Center here. And then it was obesity. And we do the gastric bypass at Flaget, and we have a lot of education classes and the walking path out on the beautiful campus of Flaget, and then smoking cessation. So we're working on some Cooper Clayton classes. And so we're really trying to make our community healthier. So we've provided a lot of outreach, and some of those opportunities are actually this Thursday. We opened an office, a primary care office in New Haven, and it's right downtown New Haven. And at that primary care office on Thursday, we are offering a free breast screening. So you'll come in, we'll have some refreshments, we have some giveaways, we even have some door prizes, some drawings. And the nurse practitioner, Deborah Desinger, will give you a clinical breast exam. If you have the history or it indicates that you need a mammogram, we will be able to schedule that for you. We won't actually do that day, but we will schedule that mammogram for you. And through the grant, through the Susan G. Komen affiliate of Louisville, we have been fortunate enough to be able to offer those mammograms to women who may not have insurance. Or if they have a deductible that's so high, they're not able to afford the mammogram because the deductible's too high. So that is, again, this Thursday from, I think it's 2 to 4, and it's in downtown New Haven. And if you have any questions about it, you can call the Cancer Center at 502-350-5700, and I can give you any information that you need about that. And then we have another really fun event. We call it the Ladies Luncheon. So anybody watching this, bring your girlfriend, your mom, your sister, your neighbor, tell everybody about it. It's going to be at the Old Kentucky Home Country Club here in Bardstown, and it's this Sunday, which is October the 27th. I can't believe October's already over. But it's from 1 to 4, and it's a free luncheon. We're going to have a great lunch and brownies for dessert, and we're going to have Dr. Paula Johnson, who is one of our primary care physicians on campus at Flaget. And she's going to give a PowerPoint and just give us some really good facts and educate us about how important self-breast awareness is, your clinical exams, your monthly self-exams, about mammography, about eating right, being healthy, taking a proactive approach to your health, trying to catch it before it gets too bad. And then we're going to have a lot of door prizes to give away, and it's going to be a really fun event. The Kentucky Cancer Program is collaborating with us and Susan G. Komen, so it'll be really fun. I hope a lot of ladies decide to bring all of their families and friends. Spread the word, because we got to help our girls stay healthy.
That's right.
And they can call again the Cancer Center to RSVP for that. I think the space is limited to about 140 people, so we just want to make sure that we don't have to turn anybody away. And it's 502-350-5700, and that's at the Old Kentucky Home Country Club in Bardstown, and everything is free. You can't get any better than that.
That's right. That's great.
And wear your pink, girls.
That's right. Pink. So we've been talking to Bobby Harned, who is with the Flaget Cancer Center at Flaget Memorial Hospital. And as we said at the beginning, October is Breast Cancer Awareness Month. November is Lung Cancer Awareness Month. So we want to hit upon really quickly a new service that is offered at the hospital with lung cancer detection.
Yes, Kentucky One Health challenged all of its facilities to try to promote early detection in cancer. Well, unfortunately, Kentucky is #1 for lung cancer throughout all of the United States.
Wow.
So that threw up a huge red flag that some work really needed to be done there. And so the opportunity that we had is to offer a low-dose CAT scan. And what the low-dose part means is that you don't get the dye injected into your veins. So you're getting a low dose of radiation for this CAT scan. Right now, when we see patients in the Cancer Center, the majority are in stage 3 or stage 4 cancer. And just like breast cancer, once it's that far developed, it's just not treatable. It's just an aggressive cancer, and it's very, very difficult. So the survival rate is very low when it's detected that early. So our goal is to offer this low-dose CAT scan, have people come in if you're over 50 years old, and if you have smoked 30 packs of cigarettes in your lifetime. A 30-pack year is what they call it. So what that means, not 30 packs in your lifetime, but 30-pack year. And how you can calculate that is if you smoke 3 packs a day for 10 years, that's 30-pack year. If it's 2 packs for 15 years, that's 30-pack year. 1 pack for 30 years. So that's how you can kind of calculate and say, hey, is that me or not? If you have a strong family history of lung cancer, if your mom, dad, brother, or sister, that's another indicator. Or if you've been exposed to asbestos or some kind of bad chemicals like that, we have a little algorithm, a little questionnaire that we ask so that we make sure that we're not going to do these low-dose CTs on anybody that doesn't need it. So typically, if you're over 50 and a 30-pack year smoker, unfortunately right now we have not been able to get insurance to cover that. So we collaborated with our radiology group that actually reads our CAT scans, and we're able to offer this throughout the state of Kentucky. All of Kentucky One Health facilities can offer this. It's $185, which is a very, very minimum amount for such a high-tech scan. And we ask that you pay that at the time of service, and once we get that result, if we were able to find anything, detect any type of cancer or precancer, then we would then have to order a diagnostic CAT scan, which meant you would probably have to get the dye. At that point, your insurance would cover for a diagnostic. It just won't cover that initial screening. We're calling it a screening low-dose CT. And it is truly to try to detect this lung cancer early. If we can detect it early and get a handle on it early, your survival rate is much greater. And if we can show statistically that it is proven to save lives, I mean, just one life, it's just huge, then we're hoping that insurance companies will begin to cover for this low-dose CT like they do the mammograms. It's very, very similar.
Great. Well, again, I've been talking with Bobby Harned, who is with the Flaget Memorial Hospital Cancer Center. And one more time, the phone number there if they have some other questions.
Yes. If any questions about the mammography, about the screening that we have on Thursday in New Haven, the luncheon, or about the low-dose CT, please give us a call at 502-350-5700, and we'll be more than happy to ask you the questionnaire if you're interested in the low-dose CT to see if you're eligible, or to schedule you for any of the screenings and educational event coming up. Yeah.
Because early detection is the key.
It is the key. And just spread the word out there. It truly, if you can tell people and empower them with education, it's the greatest thing.
So what color were you wearing in November?
November's white.
It's white.
It's
okay.
white.
So I have all our white for lung cancer
Yes.
awareness. Right. All right. Thank you very much.
Thank you, Gary. It's been a pleasure. It's a great opportunity to just share this knowledge with the community.
Well, we appreciate it. It's been Gary White for Central Kentucky Television.